Amid talk of the pandemic winding down, new data shows long COVID may linger on. Plus, later in the show, we'll go to the United Nations for a conversation with one of the leaders in the fight against climate change. Hello, I'm Arnold Knight, and this is The Heat. Climate change is high on the agenda as global leaders gather for the annual meeting of the United Nations General Assembly. We'll have more on that later in the program, but we begin with the COVID-19 pandemic. The average daily death toll in the United States is more than 350. This, as the government estimates, 7 to 23 million Americans have long COVID. William Haseltine is an expert on the subject. He's the chair and president of Access Health International and author of the new book, A Family Guide to Long COVID, Questions and Answers. Bill, great to have you with us.
My pleasure, thank you.
So let's start with the basics. What is long COVID? What are the symptoms and how long does it last?
Long COVID is the consequence of being infected by the SARS-CoV-2 virus. It takes multiple forms. First of all, shortly after you're infected, you experience, or many people experience, something called acute COVID. Without a vaccine, it's about 20%, much slower if you've been vaccinated. That lasts up to a month, and after about a month to 6 weeks, those most seriously affected will die. But the long COVID symptoms begin later. I would say the next phase of it lasts for up to 6 months to a year, and that's a series of symptoms that are debilitating. You just feel different than you did before you were infected. That includes most prominently the symptoms of fatigue. And fatigue isn't just being tired after a long night. It's so tired you can't get up, you can't work. And brain fog. It's not just feeling a little fuzzy. You have something called executive dysfunction. You really can't plan your day. You can't necessarily read. If you start to write an email, you may forget what you're doing halfway through. It can be very serious. Most people get over that. And about 20 to 30% of people have some of these symptoms. There are many other more minor symptoms, but those are the two major ones. That is, of course, unless you suffered serious damage to your organs, either a heart attack or serious lung damage or diabetes or kidney disease. But about 2 to 4% of people are seriously impaired for up to 2 years, 2.5 years now that we've had COVID around for that long. And that means they can't work. It's estimated that between 3 and 4 million Americans now are out of the job market, and we don't know for how long. And then there is very long COVID. That's something that we know with many viruses. When you're infected, there can be repercussions from that infection many years to decades in the future. For example, polio, the 1918 flu epidemic, caused people to have a high incidence, 10 times incidence of Parkinson's disease many decades later. There's a whole family of serious consequences, and it's a big problem. Probably 5 to 6 million Europeans are out of work for that. And as the pandemic continues, the infections, as you pointed out, are infecting more people every day. It's pretty serious. I might also add that COVID affects children. About 75% of American children have been infected, and up to a quarter of those have some symptoms at least 6 months later.
You know, that's right. Those figures that the government is giving us, their estimate is that from 7 to 23 million people have long COVID. Is the government doing enough to combat this particular condition? I mean, could we see a specific vaccine that'll be created for this, or perhaps some other kind of medication as well?
Well, the vaccines have some effect. The vaccines that have been introduced, particularly the mRNA vaccines, can reduce the incidence of long COVID by about 15%. That's not a lot. The thing that people have to remember is getting COVID is not a joke. It's not something, it's not like a mild cold. It's much worse than that because of long COVID. The startling fact is that you can have no obvious symptoms of the disease or a very mild disease, and you can get long COVID. You can be young and get long COVID. In fact, the average age is in the 20s to 50-year-old, the ones that get long COVID. So, and as far as we know now, there's no medication specific to long COVID. A number of the symptoms people have, heart disease, diabetes, kidney disease, and can be treated, but very few, if no treatments really for the brain problem, except for more standard kind of treatments associated with management of chronic fatigue syndrome, for example.
So as you say, many young people are getting long COVID. There's a survey that's been done by the CDC and the United States Census Bureau, which tells us that, well, firstly, it tells us that 1 in 5 Americans who've had COVID still have long COVID. And then it also tells us that older adults are less likely than young adults to get long COVID. That's, you just told us about that. And women are more likely than men to get long COVID. So what can we deduce from that? Why younger people and why women?
It's really a mystery. As we know, the serious part of COVID, hospitalization and death, the most serious parts, results are most heavily felt by the older population, 65 and up, and above 80, it's a pretty serious thing to happen. 1 in 10 will die if they're not vaccinated, if you're over 80. But that's not true for long COVID. It follows what we call a W pattern. That is, younger people, very young people are somewhat spared. However, then when you get to people who are 20 to 50 to 55, there's a peak, and then it fades away again. And we have no good explanation for that.
Now, in terms of people getting help, Scientific American had a report in which it says that medical discrimination and a lack of data also make it difficult for people of color to get help for post-COVID problems. And the reason, one of the reasons they say is, and I'm quoting them here, they say, systemic poor access to health care. How much of this are we seeing?
We're seeing a lot of it. If you look at all the statistics, they show that COVID falls most heavily on the minority populations, the Black population, the Hispanic population, the white population that is below a certain income level. The most heavily affected population were indigenous American populations. The statistics are really rough, about 20 times the rate in the indigenous populations, 8 to 10 times the rate of serious infections in those in other populations. And it's reflective of a healthcare system which is inequitable. The United States healthcare system and health altogether isn't the best. It is maybe the best in the world, or as good as the best at the high end, but that's not uniformly, that kind of services we know aren't uniformly available to many people. And it shows up in the overall health statistics of how long people live, infant mortality, maternal mortality. We're down around 34th, 35th in the world, so we're not doing well with respect to health outcomes. And that is even more reflective when a pandemic like COVID comes along. Those at the bottom of the pyramid who don't have access to high quality health suffer the most. It's something that we need to address as a country, as a people, urgently.
Bill, you were telling us a moment ago about how long COVID has impacted the workforce, and I mentioned those figures that the government has given us, between 7 and 23 million people having long COVID. 1 million people are actually out of work right now, and I'm wondering what's the long-term impact of long COVID on the economy, which is already having to deal with things like a potential recession, with high inflation, and the broader impact of the pandemic.
Well, there's multiple effects. First of all is on the healthcare system. The healthcare system is, as we said, already faulty in some ways, and it's really not geared to helping very large numbers of people who are seriously incapacitated with no obvious remedy. That takes really intensive kind of care to take care of these people who can't go to work because they have executive dysfunction, their brains You can actually see damage to the brain. It's not imaginary. You can see for people who are really fatigued, and we're familiar with chronic fatigue syndrome for keeping people out of work, that's a big dent. We actually, although we have some people out of work, unemployment is really low, and it's very frequent. I mean, everybody knows it's very hard to hire people now.
Right.
There are a lot of jobs going begging, and this is only making that worse.
Bill, we have a minute left. You know, last weekend, President Biden, in an interview here in the United States, said that the pandemic is over. But the WHO, the World Health Organization, tells us that the end of the pandemic is in sight, but we're not there yet. What is your sense of where we are now?
Well, seeing the end of the pandemic reminds me of my days years ago as a Vietnam War protester, where they said there was a light at the end of the tunnel. There can be a tunnel at the end of the tunnel, as there was then. And that's how I see it. We do not know when this is going to end. We don't know when the next variant is going to appear, only that it's very likely that it will. We desperately need new types of medication, not just the vaccines. We need antiviral drugs. And I think we're not doing enough to get those drugs that we need to put this thing to bed for good.
Bill Haseltine, thanks so much for joining us.
My pleasure, thank you.
We need to take a break right now. When we come back, how is the UN responding to the climate crisis? Stay with us, you're watching The Heat. Welcome back. In 1992, the United Nations established an international environmental treaty to combat climate change. My colleague, Mike Walter, sat down with Simon Stiell, the Executive Secretary of the UN Framework Convention on Climate Change, to talk about how the UN is responding to today's climate crisis.
Let's talk a little bit about the treaty. It came into effect 30 years ago, dealing with greenhouse gases. Clearly, you haven't been here all 30 years. You're kind of new to the role, but give me a sense of the trajectory. Where are we in terms of when it first occurred to where we are today?
Well, I think it's been a long road. I think 30 years ago, there was a realization there's a problem, and there's a problem that requires countries, nations, parties to come together to resolve them. But as the years have ticked away, and I think the landmark agreement was in 2015 with the Paris Agreement, where it was recognized that the Kyoto Protocol, which preceded it, wasn't sufficient, wasn't inclusive enough of whether it was countries, whether it was non-state actors, that what went before was insufficient. The climate trajectory has gone from, this is a problem, we need to be aware of it, we need to be doing something about it, to what we have today, which is a climate emergency. So the clock has run down on the issue very quickly, and we're now at a point where, the science is telling us we need drastic action now, and the evidence that we are seeing is telling us we need to take drastic action now. You just have to look at, well, you've just had Hurricane Fiona passing through the Caribbean, causing devastation. You've had what's happening in Pakistan, a third of the country underwater, much of it's still underwater, millions displaced, billions of dollars worth of damage. We've had a record-breaking summer period, extreme heat, fires, droughts. Climate change is very, very real, and the science tells us that we need to cut emissions by approximately half within the next 8 years. We're virtually through this year, so 7 years and a bit to go. And we need to get to net zero by 2050 if we are to contain temperature rise to 1.5 degrees. So a critical time for the planet. It's a critical time for countries. It's a critical time for businesses, for communities, for us as individuals.
Do you think that it's sinking in just how pressing it is?
For some, yes. For others, less so. But I think it's slowly, people are starting to join up the dots. Those connections are being made. And the most obvious is when it impacts you directly. If it's something that's obscure at some island, somewhere in the Pacific or in the Caribbean, some distant far land, it's abstract. But when impacts are being felt, on your doorstep, people then start to realize. And I think with each passing season, I think that awareness is increasing, but still not fast enough for people to take the necessary steps. Again, whether it's on an individual level, whether it's at a state level, we're still not doing enough. There are some positives in it. As I said, look at the, awareness is growing. There are some incredible things happening in terms of action taken. If you look at where we were with renewable energy 10 years ago, where we are now, technologies that were not viable in the past are now, offering us pathways to how we need to do this. And what is both encouraging and frustrating about where we are right now is the solutions are at our fingertips. They are there. We know what needs to be done, we know how to do it, and we know when we need to do it. There are still some gaps in that, but there is sufficient body of solution material. It is having that political will to take those necessary steps. And of course, the thing that binds a lot of the talk about how to solve this, it requires investment. And right now, the talk is about the $100 billion per year that developed countries are obligated to providing developing countries to adjust to these changing weather patterns. But even those hundreds of billions aren't what it's going to take. It is trillions of dollars. So on the one hand, there is a massive cost deficit, investment that is required. But on the other, it's also the cost of inaction. And when you start weighing up the losses, the damage that is being caused, the impacts by climate change, and that cost across the globe is far higher than the cost of taking the necessary steps to get this thing under control.
And as you well know, because you're running from meeting to meeting, for a couple of years we didn't have that here in New York because of COVID. Have you seen backsliding as a result of COVID? Because it's obviously an easy cover for a government to say, oh, well, we've got these economic hardships because of COVID, we can't really make the necessary contributions, and we'll get to climate later, when, as you know, that's not an objective anybody wants. But is there an issue there? Yes.
The pandemic caused, flows of public finance shifted from some that was earmarked for climate for other developmental purposes were redirected to addressing the pandemic, whether that is from the health perspective, whether it is from the economic stimulus packages that most countries had to put in place to address the economic fallout from the pandemic. It also drew away international attention. We seem to, as a global community, only be able to deal with one crisis at a time. So COVID, and rightly so, in terms of the threat that COVID presented, it did require that attention. But it also required that the foot had to be kept on the pedal in terms of pushing forward with climate action. There was a short respite in terms of emissions, global lockdowns, emissions reduced temporarily, but we're already back up beyond pre-pandemic emission levels.
You mentioned the doorstep. You know, I was just in Greenland not long ago, and you see the icebergs melting, and the people in Greenland say what happens in Greenland doesn't stay in Greenland. It impacts the rest of the world. You're from Grenada. You know this. Those are two Gs, but there's the other G, Glasgow, where I know you were there, trying to convince the others who aren't in those other Gs of what's going on. How difficult a task is that? What's it like to actually be at one of these events at COP26? Because I know you're preparing to go to Egypt. You know, do you see a lot of the same rhetoric every time? Is it a lot of arm twisting? Give us a sense of what it's like behind the scenes there.
Well, I think it's the General Assembly on steroids. I think it's the world's largest international conference. You have anything up to 45,000 people could be participating in one of those, the COPs. And there are two elements of it. There are the government participants, but there are also a lot of non-state actors who are there, the private sector, civil society, philanthropy, academia. So it's a broad mix, but it's the one opportunity the global community has to come together, to talk about, to negotiate, to find solutions, to reach agreement on some of the key issues that impact how we respond globally to climate change. So it's very intense, slow, it's hard, it's frustrating. The decision-making process is by consensus, and it is by parties, and you have 193 countries represented in the discussions. So to get everyone to agree to a particular position, and many of these positions have political implications, economic, social implications, so highly contentious. So it's a complex process, but it's the best thing that we have in terms of coalescing around common issues and common solutions.
Speaking of ambition, China's been very ambitious about deploying wind, solar. We know that the majority of the electric vehicles sold recently, I think Bloomberg did a story where China's gobbling them up at a furious pace. Can you talk about the efforts underway in China and what you're seeing there?
Well, China is the largest global emitter, and action taken, whether it's negative, whether it's positive, really moves the needle. So there have been some significant initiatives there, developments in solar, developments in wind, developments in other alternative energies, which are making a difference. The question, though, is the scale of the change, this shift, this transition from fossil fuels to renewables is on such a massive scale. What needs to happen, and this is, we talk about China, it's within the G20. So look at that as a collective. As a collective, 85% of global emissions, 85% of global emissions, and 80 to 85% of global GDP. So within that grouping, you have both problem and the solution. So activity, action, climate action that addresses the emergency, that is where we will see real movement in terms of getting to the targets that are required.
You mentioned Paris earlier. We remember back, it was President Xi and President Obama who really pushed that across the finish line. Clearly, you have to have these world leaders in top economies working well together. There's been friction, the trade war, that sort of thing. Is it a concern on your part at all that those frictions spill over into this lane as well?
There is that risk. And I think that is the greatest threat to a successful outcome of Sharm el-Sheikh. And what we're asking is for parties to create a safe political space within the discussions in Sharm el-Sheikh, which allow the focus to be on the substantive issues of pushing the climate agenda forward, and whether, and it may be naive in asking for this, but whether we can insulate those issues from the geopolitics that is happening around this. I mean, this is where we were in Glasgow. Glasgow had its own challenges. We were able to work through those and land with some very constructive outcomes. I'm hoping that if we are able to, create this safe space for those negotiations to take place, we are able to draw out of Sharm el-Sheikh, again, build on what we saw in Glasgow.
You talked about the G20. You're from Grenada. It's obviously one of the countries that's vulnerable. Are the voices of the vulnerable being heard? Do they have a seat at the table?
They do, and I can attest to that. Whether their voices are being translated into the urgency of action and the scale of action is another question. But they certainly have that opportunity. It is a party-driven process, and the voices and the responsibility, one of the roles of the UNFCCC is to ensure that those voices are given the space they need to get their positions across, and for those positions to be factored into that final decision.
You'll be in Sharm el-Sheikh, you've been in Glasgow, so you know what happens, and you know that there will be disappointments, there'll be some achievements. Give me your sense going in, what your thoughts are before you head to Egypt, and getting on the plane and leaving, what would be a successful COP27 in your eyes?
Well, we have to see progress. We have to see where Glasgow left off. There are, again, in each of those 4 areas. So in mitigation, we need to see greater ambition and action. We ask for parties to come back with revised NDCs showing greater ambition. We will know, I think it's the end of this week, we'll be synthesizing what has been submitted to see how is that a signal of greater progress? Whether it's an adaptation, moving forward with the global goal for adaptation, the mitigation work plan, where are we with that? So there are key elements in each of the negotiating streams that we would like to see progress on, and to see that momentum has started to build.
Simon Stiell, you'll need the strength of steel to take on this issue. Thank you so much for your time.
And thanks there to my colleague Mike Walter. Stay with CGTN America for more news and interviews from the UN General Assembly meetings in New York. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.